Hello, hi, this is Dr. Karen Perez, and today we'll be discussing about hard sounds. What create the hard sounds? What produces them? This video is a precursor for another video that should be coming up, which is murmurs, but it is vital to understand how hard sounds are made prior to understanding murmurs. So let's get into it. So there are valves that create hard sounds. The closure of valves that creates the hard sounds. So let's look at the valves that are in the heart. Now, the valve that separate the right atrium from the right ventricle is called the tricuspid valve. The valve that separates the left atrium from the left ventricle is called the mitral valve. Together, they're called the AV valve or the atrioventricular valve. The closure of the AV valves create the first hard sound. Now, for the second hard sound, it is a pulmonic valve. That is the valve that separates the right ventricle from the pulmonary artery is called the pulmonic valve, and the valve that separates the left ventricle from the aorta is called the aortic valve. Together, they're called the semilunar valves. Together, they're called the semilunar valves. So let's talk about systole and diastole, which is very important as it relates to when these sounds are actually created. So first I want to talk about systole. Systole is actually the contraction of the ventricles. And during contraction, it pushes the blood out of the ventricles, whether it's the left or the right. Diastole is actually the relaxation of the ventricle. It relaxes so that the atrium can pour or force the blood into the ventricles, and the relaxation is actually called diastole. So let's look a little bit deeper how these sounds are created. So during diastole, which is a relaxation of the ventricle, the pressure in the blood-filled atrium actually exceeds the left ventricle, because remember, the left ventricle is now relaxed. The atrium is now contracted, meaning the pressure is high, forcing the blood into the left ventricle. With that, we have an opening of the mitral valve. And remember, the opening of the mitral valve doesn't give us any sound per se. All right. Now, as the pressure in the left atrium reduces, and the pressure in the ventricle now turning from diastolic coming into systolic, now it's contracting, the pressure becomes higher in the ventricle and it shuts the valve, the mitral valve. So it is a shutting of the mitral valve. That's when you hear the S1 sound. When the pressure in the ventricle becomes higher than the pressure in the atrium, it forces the mitral valve closes. And this creates the S1 sound. Now, as the ventricle pressure increases, the pressure in the left ventricle is higher than what's in the aorta. So what happens? It opens the aortic valve and the blood forces from the left ventricle through the aortic valve into the aorta. Now, as the left ventricle forces the blood, the pressure starting to fall. What occurs is that the pressure into the aorta becomes much higher than what's into the ventricle as it ventricle goes back into a relaxation state, what happened? It shuts the aortic valve, and it is a shut of this aortic valve that creates the S2 sound. Okay, so keep in mind that what happens in the left do happen in the right, but the pressure in the left side of the heart is much greater, so you will hear the sound much louder. Another area that I want to talk about our sound is actually the S3 and the S4. So S3 occurs during early diastole. It's called the ventricular gallop or a S3 gallop. It sounds like it's saying Kentucky. Always this is considered abnormal if it occurs after age 35. However, this can be normal finding in children, pregnant women, and some athletes older than 35 years old. So please keep in mind that this can be a marked issue of ventricular overload, systolic dysfunction. All right, so this tells us that there is something wrong with the ventricle overloading. It causes a systolic dysfunction in the heart. Let's look at S4. This is caused by a resistance due to the stiffness of the left ventricle, usually indicating left ventricular hypertrophy. It's considered a normal finding in some older adults because there's a slight stiffness of the left ventricle. It occurred during late diastole. It's also called the atrial gallop or the atrial kick. It will make the sound as if it's saying Tennessee. So it's best heard at the apex or apical area, which is a mitral area, using the bell of the stethoscope. Now, we're going to be looking at where do you place your stethoscope to hear certain sounds. Now, it is at the right of the sternum, second intercostal space. First intercostal space is here, your second intercostal space is here. You will hear the aortic valve closing. So, second intercostal space, right of the sternum, you'll hear the aortic. It is the second intercostal space, left of the sternum, you will hear the pulmonic valve. For the fifth intercostal space, midclavicular line, here's your midclavicular line. Fifth intercostal space, this is 1, 2, 3, 4, 5. You will hear the mitral valve closing. However, if you have a patient who have left ventricular hypertrophy or some dilation of the left ventricle, you will see that the sound of the valve may be displaced about another intercostal space. So instead of 5th, you may hear it at 6. To listen to the tricuspid valve, it will be 4th intercostal space. So we have 1, 2, 3, 4, and it will be left of the sternum border. Understanding the location where you hear these sounds is vital in understanding where the murmur is coming from. Is it the mitral valve? Is it the aortic valve? So understanding where to place your stethoscope on the chest will definitely be vital in understanding murmurs. So here are my references. Stay tuned for my next video on heart murmurs. Thank you so much for watching.